Thank you all for joining. My name is Jeffrey Becker. I am the VP of Portfolio Marketing at FinThrive, and I have the honor of hosting today's event. I have a number of FinThrive colleagues that are going to be taking speaker roles throughout this event for you all, really to provide some expert analysis and opinions on what's happening with the cyber attack that we're all working through today, our overall response options, and really how we're seeing the industry pivot and some of the early decisions that we're seeing being made right now. So the underlying reason for this webinar is to just start coalescing the conversations that we're hearing and making sure that we're putting information out into the field that will help you all in making broader decisions on what the current state of recovery is, and supporting you in your decision-making as you pave a path forward in the short, medium, and long term. So just to give some housekeeping notes, we will be doing extensive Q&A at the close of the session. You're welcome to ask questions throughout the event, and when we reach Q&A, I will work through those all for our panelists. And so go ahead and ask your questions as you think of them, and we will tackle those one by one during the Q&A session. To give you an overview of the agenda that we've prepared today, we'll take you through just an overall background on the Change Healthcare outage specifically, and then broader cybersecurity trends within healthcare IT. From there, we will look at the short and long-term impact of this event. And this is really where we're going to start to distill down some of the conversations that we're having out in the industry and some of the early market research that's coming back to start informing recovery planning and really help you pressure test your resiliency planning moving forward. From here, we'll talk about FinThrive's perspectives on recovery and future redundancy, and then our overall portfolio of accelerated recovery options. And as with everything with FinThrive, these were designed shoulder to shoulder with you, our customers. And so you'll really hopefully see a reflection of the needs that we're seeing in the market reflected in those accelerated recovery options. At that point, we will close with a live Q&A. You can ask any questions that you have, and if we don't have time to cover all of those questions, we will pivot offline and continue the dialogue. So everybody will be able to walk away with your questions satisfactorily answered. And so without further ado, it is my honor to introduce our co-hosts and SME panelists today. First is April Wilson. She is the Vice President of Product Management for our Insurance Discover solution. David Gutierrez is the Vice President of our Customer Onboarding. Greg Serla is our Chief Information Security Officer. James Bush is a Solution Strategy Manager. And myself, your host, I am the VP of Portfolio Marketing. So to start us off today, I'll be passing the baton to Greg, who will take us through some of the overall incident background and overall cybersecurity background in healthcare. Greg?
All right, Jeff, thank you so much. Appreciate it. So with the Change Healthcare cybersecurity event, we saw, a significant. I view it as a groundbreaking event. It's one of those things that has impacted nearly everyone, and it's probably going to change the industry in terms of security for a while, at least. But historically, over the past year, 2 years or so, healthcare has become the most targeted industry for ransomware attacks and data breaches. It's affected over 100 million individuals, and that trend isn't ending. And so we're going to keep seeing more and more. And as these come up, we need to start thinking about, well, what are we doing right and what are we doing wrong? And so when we look at these breaches from 2018, it's been doubled from 369 to 712. That's pretty crazy with significant breaches. A significant breach is a breach where there's a large amount of data, PHI or PII data has been exfiltrated. During that same time, we had ransomware attacks have increased significantly. The reason why is they're relatively easy to launch, they're highly profitable, and there's a low chance of getting caught. And now we're seeing ransomware as a service where you can rent ransomware to send out to your favorite target and launch attacks, and in some cases make a fortune. So it's becoming a big problem. When we looked at when we suspect that the attack with Change Healthcare was a ransomware attack, no one's really came out and said that. Not that I can recall, but in any case, we looked at how Black Hat is attacking, and what we're finding is they're targeting Active Directory. And so, if you are thinking about how does my organization protect against the Change Healthcare event, what they went through, we'll start looking at your Active Directory and your user accounts. That's how they seem to be attacking us. So, excuse me. So with FinThrive, we had a response. We suspended, just like most other organizations, we suspended all connectivity with Change Healthcare. We locked out their users. There's something called indicators of compromise. What that is that's basically a roadmap of how an attack occurs, and we found those indicators of compromise. They're called IOCs as well. We took those IOCs, put them in our threat detection systems. Now our threat detection system is looking for those types of attacks. We've scanned for malware. We've had numerous courses and briefings with our colleagues and employees to let them know, hey, this is what's happening with Change Healthcare. This is what you need to look for, so that we're protected as well. We've conducted a manual review of our Active Directory environment just to make sure that we're doing the right thing. And then in anticipation of the reconnection to Change Healthcare, we've increased our monitoring of that connection. When it does get reestablished, we're looking at all the transactions that come back to and from that organization in a much deeper manner than we were before. So when we look at the Change Healthcare event, that we've had numerous meetings with UHG and Change, and they've said a lot, but what they haven't come out and said is, what is the scope and impact of that breach? How much data has been exfiltrated? We're told it's 6 terabytes, but what was that data? Who was impacted directly, and how deep was that impact? We're still looking for the status of the event investigation. I believe it's going to be ending soon, and we'll start receiving that third-party attestation within the next week or so. But we still don't know the exact date of the service restoration. I believe that's coming soon as well, but again, not totally sure. So yeah, so that's what I have. That's back to you, Jeff.
Thanks, Greg. So believe it or not, this event is now going on its 5th week. So just to give you an overall timeline of events, and I know Greg covered a good bit of this, the real beginning of this event is still to be identified. We don't know how long the Black Hat ransomware attack has persisted, because we really don't know day 0 or day 1 of the actual network penetration. But what we do know is that on February 21st, Change Healthcare started experiencing network outages. And just the very next day, on February 22nd, Change did make the announcement to their customers that they had been victim of a cybersecurity attack. Initial response was it looked like it might be nation state bad actors, and there was lack of clarity in what exactly was happening, but it had become clear that Change was the victim of a ransomware incident. By the 26th, Black Hat had identified itself as the culprits of this ransomware attack. There was also, as Greg had mentioned, the indication that in addition to encrypting Change's infrastructure, there was 6 terabytes of data stolen, potentially inclusive of PHI. And so that information was made public on February 26th. And at that point, we really started seeing the the rise of industry advocates such as AHA and MGMA starting to advocate on behalf of providers that were being impacted by an inability to process claims, an inability to process eligibility transactions, to receive payments, and really the acuity of the situation became very serious in that week as we all realized that it was going to be a long road to recovery. So on March 1st, a couple of important things happened. One, the payment of $22 million was made to Black Cat. And we only know this because you can see this in the publicly available blockchain wallet of that organization. And so it's speculated that that was the ransomware payment. Simultaneously, Change also made, or Optum also made available some limited reimbursement or loan options to provider organizations that were being impacted by this. So payments being made both to Black Cat and then the beginning of payments being made to impacted provider organizations. Shortly after that payment was received, Black Cat staged what is considered an exit scheme, wherein they shut down their servers. They failed to provide, we believe they failed to provide decryption capabilities for Change, and they failed to destroy the stolen PHI. So at this point, really we move from two important phases in this attack, from direct engagement with the perpetrators of this attack to just recovery efforts and bringing systems and processes back online. And so from that 3/1 date forward, it's really been an all hands on deck effort to architect our way out of this problem as everyone in the industry truly has been impacted. So during this downtime and still as late as today, there has been significant impacts to operations for our industry. Inability to process eligibility or authorization transactions, inability to submit claims, to effectively receive payments, to calculate costs and coverage identification for medications, and the ability for many organizations to run insurance discovery capabilities. And so the scope of impact is broad from front to back. Organizations are, depending on their level of exposure to this event, are finding themselves truly at a standstill insofar as their ability to charge or receive payments. The financial impacts themselves are staggering. Change Healthcare transacts 15 billion, processes 15 billion transactions annually. And so even just in the 5 weeks that this event has been unfolding, that's an estimated billion plus transactions that have been impacted. So net, the U.S. healthcare provider organizations that are impacted by this event are experiencing over $100 million in revenue loss per day. And so this event really is a catalyst and many of the conversations that we're having today are really focused on not just workarounds, not just short-term recovery, but are really starting to focus more broadly on business continuity and building redundancy across this infrastructure, because it is critical infrastructure and it's something that has not had that level of redundancy and resiliency baked into it. In a recent AHA study, we found that across 1,000 respondents, organizations are reporting widespread issues, from direct patient care impact, where organizations are having a problem with direct patient care, through 94% reporting that, of course, this is impacting them financially. And as a result, in those early days, what we were seeing is a scramble to deploy workaround stopgaps, and vendors like ourselves, as well as others and Change, have all been working hard with customers to deploy stopgaps and workarounds to help organizations in this time of need. And by and large, organizations are reporting that 81% are reporting that they've found that as being somewhat effective at based on the current state of where they are. But what becomes more clear is when we start looking at what those stopgaps look like. And so when you really start digging in to see what's happening with customers that are being impacted right now, what you find is more than half are moving to a new clearinghouse. And so you're seeing rapid decision-making in processes that traditionally would play out over a longer period. 27% are evaluating a move to a new clearinghouse. So the direct impact by this event has really just unlocked a mass exodus to move transactions to a new clearinghouse, either as primary or secondary. When we dig in a little bit further and really want to understand the longer term strategies that are at play here, what you'll find is that among organizations that were directly impacted by this, there more than 50% are planning on partnering with multiple clearinghouses moving forwards to have that sort of failover redundancy system in place. And so we're starting to see decisions being made today that will lead to having a primary and a secondary clearinghouse service in ways that you do see in other parts of revenue cycle, but have historically not been the standard for securing clearinghouse services. The nature of that decision is that what we're starting to see is a pause in a delineation between implementing short-term stopgaps and establishing a longer-term strategy. So we're all hands on deck, as are others, just to bring transactions back online and to process backlog claims. But beyond that, what we're seeing is most organizations would select a clearinghouse by going through an RFP, having product demonstrations, engaging revenue cycle leaders on requirements documentation, and making a direct efforts to really go through a full and proper procurement process. And today what we're seeing is an acceleration of business decisions to bring stopgap solutions into the organization. And why we see this as a moment for pause is our own research within our revenue management technology adoption model framework shows us that claims management, edits, clearinghouse, claims statusing, these capabilities are core to your revenue cycle. So and impact longer term strategies for managing for denials management initiatives, for revenue growth and automation initiatives. So there's a number of things that were on all of our agendas as we were coming into 2024 that we hope to soon return to that work. And establishing a strong clearinghouse and claims management partner is critical to unlocking the value that we all see and think is going to be available to those that are aggressively pursuing tech modernization within revenue cycle. And so to reiterate, the claims clearinghouse core infrastructure is really foundational and critical to enabling some of the broader and more ambitious multi-year strategies and initiatives that we're working with our customer organizations to pursue. And so it does become an inflection moment, a moment of pause where we have all been working to unlock claims and make sure we're pushing these out the door and getting payments reconciled back in. But now we need to stop and think more long-term and align our short-term needs with our long-term strategies. And so there's some key themes that we're starting to see as these bubble up. And one is that these stopgap solutions that we're all collectively working on, they need proactive exit strategies. So the recommendation and what we're learning as we work with our customers is like now is the time to plan your exit strategy from these stopgap workarounds. Manual submittal of claims is not a viable failover option. So think about how you're going to sunset your workaround processes and begin architecting a more palatable failover option for your organization. What does your failover option look like a year from now when you have the time now and the attention of your leadership now to architect this effectively? And importantly, not only do we have the attention of our teams and our leadership right now, but business continuity budgets are going to open up to support these initiatives. You're going to be presenting to your boards on what your mitigation strategies are going to be to eliminate this risk in the future. So now is the time to effectively plan your exit from your current stopgap strategy and your workarounds and start putting the process and budget in place to design and architect a meaningful failover strategy for your future. And lastly, ask the right questions of your vendor. Ask how you're securing your systems, how you're building redundancy and failover mechanisms into your own processes, and really starts to level up the focus on cybersecurity within those RFP processes and within that overall procurement processes. So at this point, I will pass the mic back over to Greg, and he will take us through FinThrive's architecture.
Right. Yeah. So thank you, Jeff. Yeah. So just what Jeff said, we when we look at our failover strategy, we're a hybrid multi-cloud environment. We're at Microsoft Azure first, and then where the stack aligns, AWS is brought into the mix. We have our primary data center over in Louisville, Texas, and then we have a backup or a DR data center for our on-premises in Phoenix. There is an express route private endpoint between our data centers and Azure for that secure connection. And we use best of breed hardware, software, and cloud services. Just like you see down at the bottom, those are some of the products and services that we're using in our environments. All services are monitored, and we have a 24/7 by 365 global ops center that conducts that monitoring, and alerts are going out, and we have a world-class team that is looking at these alerts and responding very quickly when something comes up. So that's the look at the multi-cloud infrastructure. Let's move on to the next one. Thank you. So you might be wondering, well, where does your specific application lie? This is a list of our products and where they're sitting. So we see a couple, four products are sitting between Azure and data center, and then some are exclusive to Azure, some are exclusive to the DC, and then we have AR Optimizer, which is sitting over in AWS. All right, back to you, Jeff. Oh, my apologies. Back to me, Jeff. All right, so the FinThrive security program. So we believe, if I do say so myself, have a world-class security program we built here at FinThrive. So we align with NIST CSF, so the NIST cybersecurity framework. We're high trust certified. We have SOC and ENAC certification as well. We also pay attention to those industry best practices that are sitting out there. In addition to that, we have executive oversight with our Security and Compliance Council team. The Security and Compliance Council that has executive oversight that tells us, we bring these concerns up to that executive team, and they say, hey, look, this is what we want you to do. Here's the money, go for it, right? And so it's nice to have that executive buy-in. With the security program, we have 4 pillars, and the security team is not a small team. It's roughly 21 or 22 people. And we divide them into 4 different pillars. We have our security operations center, the security operations team. Again, this is 24/7 by 365 staff. Our security team is all internal. We do not outsource any security operations or any security functions to another organization. This is all an internal team. They all report to me. In addition to our security operations, we have security engineering. They're responsible for architecture and engineering of our security tools, and they look for those areas where we can improve our tools and make suggestions and get those implemented. Then we have our AppSec team, right? And that team is responsible for secure code practices. So they're scanning the software, making sure the code is secure. They're holding the dev teams accountable for mitigating those findings when the code when the scanner pulls something up. Code is scanned regularly all the time. It's not a well, we're going to scan it once this quarter. We're going to say no. It's constantly ongoing, and they're getting reports, and there's a live view that dashboard that the AppSec team monitors. In addition, we have internal penetration testers that are part of that AppSec team. They conduct red team exercises. So they're constantly hacking our environment, or at least trying to anyway, trying to get into our environment, make sure that that there are no holes that are sitting out there. Whenever we have a major release, or if there's a patch that's put into place that could potentially impact security, they're going to test that to make sure that that patch does not impact security. And then finally, we have our risk management team. They're conducting risk assessments against all of the products in our internal, in our corporate environments. They're also responsible for third-party risk. So they're looking at our vendors, making sure our vendors are doing the right thing. Supply chain attacks are a big hole where the bad guys and the bad girls are getting into systems. They're attacking that attack chain, that supply chain, and then getting their target. FinThrive is a part of that supply chain to you, and so we're making sure that we're doing the right thing. And then just to kind of go over some of this other the above and beyond. Like I said, we do a lot of there's a lot of really cool stuff that we're doing at FinThrive. We have the budget, we have the buy-in from the executive team, the buy-in from the board. One thing I did want to announce today was that we are creating a cybersecurity council for our customers, and that's coming soon. But what we're going to do is we're going to meet regularly. We want to partner with you all to help us with cybersecurity. We want to help you with cybersecurity. We want to have that dialogue between our organization and everyone else, so that we're all on the same sheet of music and we're all protecting ourselves, and we all have the information that's out there. We can only be secure if we all work together and secure each other. So that's one of the things that we're coming up with. Look for that to be announced within the next couple of weeks, maybe 3 weeks. Still working out the detail on that. And then finally, we'll talk about the data protection, that bullseye that you see there. So what that really is saying is that we take the most restrictive requirements across all of our compliance requirements and then the industry best practices, and apply them to our products and our processes. In fact, our security policies, our cybersecurity policies for the company are based on high trust. They're based on SOC. They're based on ENAC. So those requirements that are sitting in there, along with best practices, are written in our security policies to make sure that not only are we compliant, but we're doing the right thing in terms of what our customers want us to do. And I think that's it for this slide. Pass it right back to you, Jeff.
Very good. So really piggybacking on what Greg said, a lot of the narrative in the media right now is focused on the cybersecurity attack, and that providers don't have an option on where to turn or who they can work with to respond in this moment, in the short term or in the long term. And what we just want to remind you is that FinThrive is a customer-led organization. We're a customer-led organization in how we respond in the short term, and we are a customer-led organization in a number of other areas. Greg just talked about our cybersecurity council, which again will be customer-led, but all of our solutions at FinThrive and all of our responses are truly customer-led. We have customer innovation councils that lead the work that we do in patient access, in claims, and clearinghouse, and insurance discover, and all of the areas that have been impacted by this cybersecurity attack have our innovation work in those spaces has been led by customers since really the beginning of FinThrive. This is a core part of our DNA. And today, just this morning, as per class research, FinThrive stands at #1 in class in patient access, #1 in class in claims management, in clearinghouse, #1 in class in insurance discover. So truly all of the areas where this ransomware attack has crippled our healthcare partners, FinThrive sits at #1 in class research. And it is because we work shoulder to shoulder with revenue cycle leaders to make core business decisions and innovate on these processes. So we just want to reiterate that you do have options. There are partners here that are at the table that are here for the short term and here for the long term. And to speak more directly to some of the short-term solutions that we are bringing to the market, I invite our next speaker, David Gutierrez.
Perfect. Thank you, Jeff. Yeah, so I definitely want to talk a little bit about what the customer onboarding team has developed for some of the rapid deployment options. So we created 3 essential plans here. We have the Essential Accelerated, Essential Plus, and the Advantage. So I want to take a little deeper dive into what these rapid deployment options look like. So Jeff, if you'll jump to that next slide for me really quick, and we can touch on these at a high level. So the Essential Accelerated, it's our fastest option to get you up and running, to get claims out the door in as little as 14 days. And what this plan includes, it's an insurance master setup, up to 3 payers that require EDI enrollment, default duplicate and conflict checking, manual claims attachment uploads, and some virtual training sessions. What this doesn't include is outbound files, integrations to some other systems, bridge routines, and custom edits. But it helps us to get you up as quick as possible. And then you can keep in mind at the end of that rapid deployment, we can come back and look at this implementation and see if there's any further custom work that you need to complete the rest of your enrollments and any other pairs that need to get up and running. And then for the Essential Plus, this is the plan that includes everything from the Essential Accelerated, but maybe you need to look at some additional sites or some light customization. And then we can expect these to take maybe up to about 30 days, just depending on that scope of work that you're looking to see get completed for this project. And then for the Advantage, this is everything in that Essential Accelerated plan, but maybe much more complex in scope and customization. So these timelines vary a little bit, and we'll work together on what that discovery and scope process looks like and put together this plan. So really, just to get this kickstarted, we need you to complete the business process questionnaire, receive a copy of your insurance master, complete the discovery and scope review process. So to get this moving along, just reach out to your customer relationship directors or your customer success manager. You can reach these folks at mysuccess@finthrive.com or at finthrive.com/accelerate, and we're here to support you. So whatever you need to get this ball rolling. And Jeff, I think I'll kick that back to you or to our next one.
Thank you, David.
You got
it. Next up is James.
Hello, everyone. James Bush. We have similar options kind of pointed out for David, but this time for our insurance verification. 3 approaches to this model to get you up and running as quickly as possible, as you can kind of see, as little as 1 business day up to 3 business days, depending on the model that you choose. So obviously, of course, the insurance verification eligibility has been a difficult problem for most, and requiring your end users probably to go to multiple portals in order to verify coverage. So our quick solution, or the quick stand-up solution for this, would be our Health Solutions portal. It would be a manual entry for the staff. We can stand this up as little as 1 business day, and there's no IT lift for this one. That will grant you access to 880 payers in our arsenal. There's a couple other customizable capabilities and functions within the solution. I'll point that out in just a moment. Additionally, our second option would be like a batch file processing, CSV or pipe delimited, EDI 270, 271 capabilities, a minimum of 2 business days to get that stood up. But we can, of course, take that massive or that large file and, of course, run that coverage discovery on those, the verification on those, and produce, of course, the required benefit information that you need back. So that, of course, is available. And then, of course, there is an integrated aspect to this solution, or if you will, for real-time 270, 271. That will, of course, be embedded in whatever system that you currently have there. About a 3 business day stand up for this one. And again, of course, requires some IT involvement with this, but that will be an EDI 270, 271 in response. But this could be with a standard SOAP format and or an X12 file. Next slide, please. So the first option, the portal option, this would be, of course, a web portal. They will log in, simple, of course, login. They, of course, would utilize their the traditional methods of searching for coverage, name, date of birth, or whatever the requirements are for that particular payer that they've selected. There's an opportunity for them to bookmark whatever their top payers are. In either sense, it will bring back, of course, the coverage for that particular patient that they put. Any active coverage will be highlighted, and inactive coverage would also be highlighted within the platform as well. The solution will also bring back the tracing and tracking numbers for the staff to view in that moment. There's a second part of this screen which actually kind of breaks down the coverage. Would you go to the next slide for me, please? Underneath that, because it's kind of large there, but it would have actually provided additional information about the service types and their ability to actually even sort that out and provide additional information about the benefits available within the system. Additionally, inside of this particular portal, there are capabilities and functions for them to customize their service type views, similar to their ability to kind of customize the views of payers that they can see. And we also do some payer tracking in there also. We typically go out every 30 minutes to track the payers in this system to see whether or not they're down. Anything over 21%, if we feel that it will cause an impact to your organization, we of course will communicate that directly to you. And that's also available inside of this particular platform. If you go to your next slide, I think it talks about the batch option. So option 2, as pointed out earlier, allows, of course, you to input and, of course, batch out some coverage discovery and eligibility responses here. So as you can see here, again, we are feeding in that batch into our system, and then, of course, we'll push back out to you a batch of eligibility benefits that were found for your patient population. Again, a very simple lift for our organization. Next slide, please. And then finally, we have the opportunity for us to actually take that 270, 271 information and embed it directly within your solution, whatever EMR, EHR system that you're using, allowing you, of course, to do a call out of a 270 to our clearinghouse, and then, of course, push back that 271 back to you. That will still give you the same connection as all of the other 2 models there, but of course the information would be housed directly inside of your solution in a real-time functionality. All right, with that, I think I will turn it over to April.
Thank you, James. While the majority of the cyber attack impact has been with eligibility and claims, it's also impacted Insurance Discover, which spans both of those particular areas. Since there is a significant amount of confusion in the marketplace about exactly what the difference is between eligibility and Insurance Discover is where we search for coverage not presented at the time of service. So lots of times that's true self-pay, but we also do look for secondary and tertiary coverage as well. And we are the #1 best-in-class product doing so. Next slide, please. Whether you're running Insurance Discovery on the front or the back end of the revenue cycle, we do have it in both places. We just relaunched our real-time Insurance Discover front-end product at HIMSS a few weeks ago, and we are bringing the power of our award-winning back engine to the front end of the revenue cycle. So if you're impacted at all, since the solution, we can assume we know who's got coverage, we can use the eligibility solution to ensure that that coverage is true and accurate and active. And we can also resubmit the claim on your behalf if needed, but we are ready to help you if you are impacted. Next slide. So just like the other solutions, we do have 3 quick start options available to you if you are impacted. The first one is an interim solution. It is purely a batch in, batch out solution. We can accommodate as many batches as you need just to get you through the hump right now. If you're interested in implementing the full solution, we do have a quick start option where, as long as we can get you to conform to our file specifications, we can get you up and running in a matter of days. And if you're a former Insurance Discover customer, we can't wait to welcome you back. We still have all of your configuration settings saved. So as long as you still have our file specs and can conform to them, we can get you up and running in a few days as well. Back over to you, Jeff.
Thank you, April, and everybody else that has contributed to this conversation thus far. So we can close out our time together today. So I just want to thank everybody for joining us. We're happy to stay on the line until the close of the hour to answer any follow-on questions, but just reaffirm you do have options, and now is not the time to make long-term decisions based on stopgap workflows. This is an opportunity where executive focus and budgets are aligning to make true redundant business continuity decisions. And FinThrive is an organization that is #1 in class for a reason. We are making our business decisions shoulder to shoulder with our customers, and we build our products shoulder to shoulder with our customers. And that is the reason why we're #1 in class in patient access and eligibility, and we're #1 in class research on claims and clearinghouse and Insurance Discover. It is because we couldn't have built what we've built without the partnership of our customers. And so in this moment, we also want to be sensitive, and we think that we are truly the only the best offering in the market that blends the short-term needs of recovery needs of our customers with the long-term, more strategic needs of overall business continuity and creating resilient and redundant systems. So I thank you all for your time. We will stay on the line until the end of the hour, so you're welcome to stay with us, and we'll continue answering questions. But if not, thank you, and we will follow up offline.